Hi everyone, and welcome back to the Guidewell Insights Lounge. We're here at day 3 of Singularity University's Exponential Medicine. Everyone, my name is Kate Warnock, and I have a very distinguished guest right now. In the lounge we have Lindsey Mosby. Lindsey, welcome to the interview.
Thank you, thank you.
Lindsey is the Executive Strategy Director of Healthcare at Frog Design. Lindsey, we actually have a relationship with Frog Design
Yes.
at Guidewell. You were instrumental in helping to set the strategic focus for the Guidewell Innovation Center. Can you tell us why patient-centered design should be considered for any entity hoping to innovate in healthcare?
Yes, absolutely, and you're right. We do have a history together, which is fantastic, I think we all feel really good about the work that was done with you guys, and really appreciative that your organization is actually doing work like this, because as you sort of imply, it's not been traditional for healthcare systems to sort of use a user-centric design process. Which is kind of ironic considering that healthcare is all about people at the end of the day. So I actually like to sort of talk about how I think there's this odd dichotomy in healthcare, right? We're an industry that is highly focused on caring for people, and we do some of the most innovative things ever done. If you think about what we're doing with surgeries, with nanotechnology, we're doing incredibly innovative stuff. But it's like we don't give ourselves credit for that innovative capacity when it comes to the way that we work or the way that we actually engage with people. So one of the things that I think Frog and organizations like us can bring to the table is that outside-in view, right? Like practitioners, clinicians, people who work in the healthcare system, they're doing what they have to do all day long, and you don't have a whole nother body or brain to think about something in a completely different way. So the best work for us is being able to come into an organization that has all of that deep clinical knowledge or has that deep expertise, and we can come in and say, now let us help you think about what it's like to be that patient, what it's like to be that caregiver, what it's like to be that nurse, and put that human-centered sort of lens on everything. You know, and I don't want to understate what we do by any means, but I do think that we're all very, very capable of empathy. And at the end of the day, what design-centric thinking is largely about that. It's largely about being empathetic and being able to put yourself in that other person's shoes.
All right, Lindsey, let's start with a couple use cases.
Sure.
Tell us how maybe a traditional hospital setting, clinical setting, might be disrupted and become much more patient-centric.
So one of the things, and this is actually an example that is maybe not going to be quite as big of an idea as it might have been when I was talking about it a year or two ago. I'm really looking forward to hospitals, the big ones and the small ones, taking a really good hard look at how people move through their institutions, quite literally. If you take a look at what we're doing with wearables now, and the work that's some of incredible companies like Disney have done with RFID technology and the ability to know you, place you, understand flow, understand pattern, all of that. It's going to be, it would be an awesome experiment to work on something like that with a hospital, maybe a community hospital working with a chronic care population. Let's take some of that emerging technology and see how it might inform not only how we engage with our as a patient and as a doctor, but potentially even the workflow of these hospitals. Right now you go to an emergency room, you might still get one of those little restaurant pager things, depending on where you are, right?
Sure.
That says, we'll let you know when you're ready. What about, there's so much more sophisticated ways that we could actually be monitoring, so to speak, and even being able to follow up with care outside of the hospital, right? So if I've got somebody with a chronic disease, we know how much that costs, we know how much impact that is on a person's life. How about we use these emerging technologies to follow people outside of the hospital so that when we do come back in for whatever checkup it is, there's all of this really rich intelligence that helps us, better treat, better titrate how we treat, and hopefully have better, richer conversations with each other about treatment as well.
Well, Lindsey, your response, it just leads to a perfect follow-up question. We've been talking about ambient technology that might be embedded really wherever you live, in your home, in your car. How is it that you see design really being so critical to ambient technology being adopted and really living up to the potential that we've heard being discussed here?
So I absolutely think this is where it's going, right? Like, I do love my phone, like I know we all love our phones, and I am totally addicted to it and carry it with me everywhere. But I look forward to a day when I'm not tethered to something, right?
Sure.
When I'm no longer sort of hooked into something that's not me, so to speak. And I do think that that's where it's going. I think, actually, the aging population is a really interesting place to learn about ambient technology. One of the things, we've actually done a good bit of work in the around aging and aging by design using emerging technologies. And one of our best findings of being out in the field and in some really wonderful seniors' homes was how what would work for them is not to bring in some newfangled system that they have to mess with, but to embed the smarts in the things that they already have, right? So don't introduce a brand, not that that's not a good thing, because you can introduce wonderful new systems, of course. But I'd like to see us really trying to think about how the stuff of our daily lives, whether it's the refrigerator, we all know
Sure.
about smart appliances, or our walls and smart ways of using light. Thinking about how do we use the TV or the alarm clock, sensors in the commode, all of these things,
I have
right?
to give the example. We had David Metcalf from UCF on yesterday,
Okay.
and he was talking about the smart mirror.
Yeah,
that
yeah,
where
yeah.
you can even you can get your BMI, you can do your pulse, you can do all sorts of things, even possibly have two-way communication with something as simple as a mirror. So I think that that's really the future that you see.
Yeah, absolutely, absolutely. And I think too, so I was talking with someone here actually and having a great conversation, and she described the artifacts of technology as potential interrupters of our experience, right? And what you want to do is remove those interrupters.
Right.
And I really like that terminology, because that is what it is, right? If I have to push or engage or manually do something, then I'm not really just kind of being present, being in the space, or living my regular life. So we're at the beginnings of it, of course, but I think that the Internet of Things and the ability for it to just be in the background and yet still be actively supporting us is really interesting territory.
I want to go back. You had referenced the aging specifically.
Yeah.
The aging population, I had a question for you specific
Okay.
to that. We're going to see what's being dubbed the silver tsunami. As the boomers age into an older state where they might require more care and more intervention.
Yeah.
How do you see technology and design impacting that population in particular?
Yeah. It's interesting. We have definitely been working in this space for a couple of years now, and it's actually more of a passion area for Frog. We didn't get into it specifically because we had a client ask. There was just a number of us who were very, very interested in, how are we going to care for the massive numbers of people that are going to need us.
Absolutely.
When we know we don't have the infrastructure or the literal human beings to be able to do all of that caring. And it's a global issue, right? And we also had another group of us that was really, really interested in embedded and wearable technologies. So we kind of got together and realized, we should play around in this space. Took ourselves through our own process and literally kind of went out into the world. And what we really found was, there's a couple of different kinds of seniors, right? So there are seniors who are in that 80 plus age, who have a very different comfort level and sort of willingness to engage with technology. And I think some of what we were just talking about a minute ago is incredibly relevant for them, right? So stuff that they don't actually have to learn how to do, right? Frictionless, right? I think fabric, adhesives, there's a lot of really interesting territory there for that group that actually would be applicable with other population demographics as well.
But as far as usability, really,
but as far as
really
usability,
applicable.
right, yeah. What can we do with smart fabric? What can we do with some things like that? The other group is more to your point, the baby boomers, right? They are, they're fantastic and interesting because they are elders. They are not afraid of technology.
Not at all.
They're not.
We had Corey Lathan on just a moment ago, and she was talking about how her father, who's 75, has AFib and uses his iPhone to track with an app on his iPhone to make sure that he's not in AFib. So there you go. My
dad has the latest and greatest technologies before I do. Absolutely. I mean, these are the people who saw us land on the moon. These are they are very, very comfortable, and they're also highly motivated. Like, it's a very active, it's a very mobile, literal and figurative, generation. And so I think they also the recession notwithstanding, and I certainly wouldn't want to blanket everybody as being able to afford what we might call luxury items, but I do think that they're willing to spend on things that they feel bring value to them, whether that's covered by insurance or not, right? So I think we are going to see them be willing, and the data seems to sort of show too that they're sticking with wearables longer than some of us, right? Because there's a real value. They're seeing, if I do track this, I'm able to control X, Y, or Z.
And really
better.
maintain that independence, which, in the caretaker generation, especially,
right.
that's such a primary driver.
It's a huge driver.
Right,
And it's
right.
the one thing, right? I think we found sort of there were 4 key sort of human elements that people wanted. It's the idea that you remain independent, that you are able to stay social, that you are able to keep to your own routines.
Absolutely.
All of these things are the things that people are desperately holding on to, because if you lose them, that's when people start making decisions for you. Right? And
Right.
that's what you don't want to get to. So how can we use technology to stave off those sort of, those shifts, those big changes, keep us healthier, safer, more kind of, together longer?
All right, little pivot for you.
Okay.
So we've heard so much about genomics and the microbiome here at X-Men. I know that you were just in our own Chris Hillier just led a workshop on the microbiome. How does design thinking apply to those 2 particular fields?
Okay, so I'm certainly not going to claim to be an expert in these fields, but I am absolutely fascinated by the potential and I think what the promise of these 2 fields really are. And this is probably heresy to people who are actually in this field, but I feel like there's this really interesting relationship between genomics and the microbiome and like what palm readers do, right? So if you go to a palm reader, as I understand it, one hand is your birth hand, right? This is the hand, this reading is what you were born with. That's kind of the genomic side of it, right? That's the thing that holds, that is not static, but stayed. Your other hand is your life hand. It's what's been happening to you as you've moved through your life. So if you look at your palms, they're not the same. So this is your microbiome hand, right? Like this is the microbiome to me becomes something that we have much more self-control over,
You
right?
can influence it.
Right.
Absolutely.
I can influence what I take in. I can influence what I'm breathing in, what I'm drinking, how I'm sleeping, all of those things. And I think that it bodes incredibly well for proactive health and more preventative measures, which I think, if we're really gonna be able to make a significant dent in the way healthcare works today, we as patients also need agency. We need to be able to take responsibility. It's, it can't just be on the caregiver, or it can't just be on the doctor.
So
I want to be in control.
Lindsey, are you at Frog? Are you piloting anything in those fields? Can you give us kind of an example of how design thinking, again, might impact those 2 very, bleeding edge fields?
I'm probably not at liberty to sort of say names. A lot of our work is typically, we try and remain circumspect, but we have had the opportunity to work with a couple of companies in the genomics space.
Okay.
And we've been working in the direct-to-consumer side of things. So that's a really exciting part, right? Like there's certainly the selling to the research scientists and all that kind of good stuff. But figuring out what it's going to be like to, what sort of products and services can you deliver to the individual, and what does that mean? If you're going to give somebody that information, what are they supposed to do with that, right? Don't just hand it to me. I need to activate on it.
Right.
So a lot of the really fascinating stuff, I think, is us trying to figure out why people want the information. And once you're given it, what are you going to do with it? How are we going to empower you to actually do something with that information? We haven't had an opportunity that I know of to work in the microbiome space yet, but I'm just waiting. I'm ready.
You did the fingers.
So ready. Yes, absolutely. Yes.
We had Theo on earlier, and I'm blanking on his last name, forgive me, but he is an artist, and is really his whole entire focus of his company is to engage artists, and he named the millions of people with MFAs and credentialed artists here in the United States in particular, and how their creative minds really can help to translate the opportunity of the healthcare industry, whether it's through, perhaps better design of technology, or, really taking that holistic view of the person, where technology might only, as you really said, the basic design of a clinical setting right now isn't necessarily designed around the person that
No.
it's meant to care for.
Right.
So, I see such parallels between what you're focusing on at Frog, what Theo is working on with his group, in that the opportunity to engage creative people to totally disrupt what we think of as far as care delivery, what technology looks like, and how people interact with it.
Yeah.
You must be thrilled to be at the position you're in.
It's a lot of fun, and it's an honor to get to work with people who are doing such incredibly powerful and meaningful work. I've been in the design field for the better part of my career, and I've been focused on healthcare for a long time, and I can tell you there's no more rewarding work than providing products and solutions that mean something to somebody, that do something to improve a life, or to take the stress off, or to relieve a pain. It's great work. I feel very, very lucky. Absolutely.
What a calling, and I think I'm sure that Frog Design is so fortunate to have you in the role that you're in.
Well,
so,
thank you.
Lindsey, it's been delightful talking to you.
Thank you.
I hope you enjoy. I'm sure that you will. The rest of Exponential Medicine here.
Yes.
We're nearly back to main stage. We're going to have perhaps one more clip before we go back. Lindsey, my name is Kate Warnock. Thank you so much for joining us here.
Thank you all. Thank you.
It's delightful having you. We'll be up with another interview in just a moment.